Hello, welcome to Chapter 9, Health and Disability Income Insurance. My name is Dr. James Yohe. I am an instructor at Gadsden State Community College, and this is for Business 146. All right, today we're going to talk about some healthcare basics, and we'll get right to it. Okay. What is health insurance? It eases the financial burden people may experience as a result of illness or injuries. You pay a premium or a fee to the insurer. Okay, so that's your insurance. You have medical expense insurance and disability income insurance. Those are two different types of health insurance. Okay. Um, one thing we want to look at is certain government acts or bills. And the first one we're going to look at here is the Affordable Care Act. Okay. Health insurance covers most covers most individuals. Usually it's employer sponsored. The employer pays a part of the insurance. Of the cost of the insurance, or most of it. Okay, depends on where you work. Okay. The Affordable Care Act of 2010 requires large employers to provide health insurance coverage to all their employees. The ACA protections related to employment-based group health plans include extending dependent coverage until the age of 26. So if you have a child, you can insure them up until the age of 26. It prohibits pre-existing condition exclusions. So if you're changing your insurance, okay, and you have a pre-existing condition, they cannot refuse you because of it. It's banning annual and lifetime limits on coverage for essential health benefits, and requiring group health plans and insurers to provide an easy to understand summary of a health plan's benefits and coverages. Okay. So this is under group insurance here. Excuse me. Now, another act here that is important is the Health Insurance Portability and Accounting Act of 1996. Set federal standards to ensure that workers would not lose their health insurance if they changed jobs. As a result, a parent with a sick child, for example, can move from one group health plan to another without a lapse in coverage. Moreover, the parent will not have to pay more for coverage than other employees do. HIPAA also protects against discrimination in health coverage based on certain health factors such as prior medical conditions, previous claims, experience, and genetic information. Okay. So if you change your job, you can get insurance. Individual health plans. Most people, as we said before, are covered under group health plans through their employer, but it is possible that your employer doesn't offer the insurance. You could be self-employed, or you could be dissatisfied with the insurance that the group plan that is provided by your employer. These people would want to go towards individual health insurance. Okay, you can buy this individual health insurance directly from the company of your choice, and there are individual or family plans. Now, this type of coverage, of course, your employer is not going to be subsidizing, okay? And rates can vary, so you should comparison shop. Don't just call one company and say, I need health insurance, and buy it. Call a number of different companies, and you can compare, okay? The Cobra Act of 1986 requires many employers to offer employees and dependents the option to continue their group coverage for a set period of time following a layoff. So you can't go in and quit. All right. You have 60 days from the date the notice is sent or from the date your coverage ends to elect Cobra. Okay. Now, in order to receive these Cobra benefits, you must work for a private company or state or local government to benefit. Now, the one thing you have to remember with Cobra is, let's say you get laid off from a job and you want to keep your current insurance coverage while you look for another job. Okay. What you do here is you have to remember that you're going to be paying the full insurance premium. Your employer doesn't subsidize it anymore. So it's very expensive. Okay? But you can keep your insurance. The different types of coverage. Basic health insurance coverage includes hospital expense coverage, surgical expense coverage, and the physician's expense coverage. Hospital expense coverage pays part or all of the hospital room, board, and other charges. And oftentimes there is a deductible, and that is the set amount that a policyholder must pay per loss on an insurance policy. So, for example, if you go to the hospital, you have a $200 deductible, or $500 or $1,000, whatever it is. That's what you pay, and then the insurance covers all or part of what comes after that. So let's say you had 80% hospital expense coverage after a $1,000 deductible. You would cover the first $1,000 of expenses, and then let's say the bill was $2,000. So you covered the first $1,000. There's $1,000 left. The insurance company would cover 80% of that, so that would be $800, and then you would owe an additional $200. This is something you need to make sure you understand when you accept a health coverage plan. Okay, what are the hospital expenses? And then there are surgical expense insurance, where they pay for part or all of a surgeon's fee for an operation. And then you have physician's expense insurance, pays for the physician's care that does not include surgery, such as office visits, lab tests, and x-rays. And as we said before, they may pay all or part. Okay, a lot of times when you go see the doctor, say you get the flu, they're going to cover a part of that. You have a copay or a deductible that you have to pay, and then the insurance covers the rest or a percentage of the rest. Major medical expense insurance covers expenses for a serious injury or long-term illness. This is different than what we talked about here. May include a deductible, co-insurance, and a stop-loss provision. Okay, there may be a maximum amount that can be covered here. And then you have comprehensive major medical insurance, a low deductible offered without a separate basic plan. Covers hospital, surgical, and other bills. Now, here, other types of health insurance. One thing is a hospital indemnity policy. And this is different from your health insurance. This is extra. You oftentimes will pay for this. Aflac offers this. Okay? It pays you a fixed amount for each day you are hospitalized. And it pays you, not the doctor, not the hospital. You get a cash benefit here. So let's say they pay you, I don't know, $200 per day while you're hospitalized. You're hospitalized for 5 days. You get a check for $1,000. Okay, does not cover medical costs. You can choose whether or not to use that money to pay for any additional medical costs that aren't covered by your health insurance policy, or you can use the money for different things, maybe living expenses while you were hospitalized because you're not working. And this is a supplement to other plans. Then you have dental insurance, dental expense insurance. Okay, this is typically offered separate from your medical insurance. This covers exams, cleanings, x-rays, fillings, root canals, and oral surgery. Now here, oftentimes you will have to pay the dentist. You have to check the policy. You will have to pay the dentist out of your own pocket, and then they will reimburse you a fixed amount for these services. So maybe you go in for a root canal, right? And the dentist tells you $500 or whatever it is. You might have to pay the $500, and then the insurance company would send you a check for whatever they're going to cover. Vision care covers eye exams, contact lenses, and glasses. Psychology of dread disease policy, something people might be wondering if they might be happy to have right now with coronavirus, but this is kind of a shady deal. Pays out for very specific conditions. Illegal in many states. They play on specific fears. Usually sold by mail, newspapers, and door to door. I have no experience with this. I've never even been offered one. Okay, and then limited long-term care insurance. This is something a lot of people want to think about, and it makes sense for those with a net worth of between $100,000 and $2 million. Covers daily help if you're seriously ill or disabled. Also, it covers nursing home or in-home care. Okay, a lot of us don't really think about too much what's going to happen when I become seriously injured or ill or need to go into a nursing home. Okay, and this insurance helps take care of those fears and helps cover that. Now we'll go over here. Major provisions of the health insurance policy. The eligibility. These may vary with age, marital status, and dependency. Okay. Assigned benefits. The insurance pays your doctor or the hospital directly. Internal limits. There might be a fixed amount per day for a hospital room. There's oftentimes a co-payment, cost sharing in the form of a flat dollar amount you pay, such as $10 per office visit, which is probably very low nowadays, probably looking at least 30, and then $10 per prescription. Okay, and that can vary according to what type of a drug you are prescribed, whether it's a generic, whether it's a special drug. Okay, usually that's going to be an insurance policy, and you want to make sure you know about that. My insurance here at the school has different payments based on what type of medication it is. Service benefits. You are entitlement to specific services. And oftentimes there might be a benefit limits, a maximum dollar amount or maximum number of days in the hospital. And when you take out insurance, one key thing you should look for is that the hospital insurance should cover at least 120 hospital days in the hospital room and board paid in full. They should provide at least a $1 million lifetime maximum for each family member. That's at least. Pay at least 80% of out-of-hospital expenses after a yearly deductible of $500 per person or $1,000 per family. Should impose no unreasonable exclusions. Limit your out-of-pocket expenses to no more than $3,000 to $5,000 a year, excluding dental, vision, and prescription costs. Although health insurance plans may vary greatly, all plans should have the same basic features. Okay. There oftentimes may be exclusions and limitations. Okay, cosmetic surgery is one of them. Guaranteed renewable, cancellation and termination. Explains the circumstances under which the policy can be canceled. Okay. Now, when you're picking an insurance, there are trade-offs, coverage trade-offs, reimbursement versus indemnity. Reimbursement pays actual costs. Indemnity pays specific amounts, and we talked about that with the indemnity insurance earlier. You want to look at internal limits versus aggregate limits. Okay. We'll get to that in just a second. Another thing you want to look at is the deductibles and the co-insurance. Oftentimes, the higher deductible will cause a lower cost to the insurance. Back here, internal limits versus aggregate limits. A policy with internal limits will cover only a fixed amount for an expense, such as a daily cost of room and board during a hospital stay. A policy with aggregate limits will limit only the total amount of coverage, the maximum dollar value you pay for all benefits in a year, such as a $1 million in major expense benefits, or it may have no limits. Okay, so here, with the internal limit, they're going to limit how much they pay per day for, say, a hospital visit. So you want to look and see if that's the case. In that case, then maybe they charge you $200 a day for the hospital room, but the insurance only covers $100 of that. Then you'll be forced to pay, or not forced to pay, but you'll pay the difference between the two. An aggregate limit will set a limit on how much they'll pay per year. Here, internal limits versus aggregate limits. I'm sorry, my fault. Deductibles and co-insurance. We talked about that already. Out-of-pocket limits. Okay, we talked about that. The insurance policy oftentimes will have a policy limit the amount of money that you must pay for the deductible and co-insurance. After you've reached that limit, the insurance covers 100% of any additional cost. Out-of-pocket limits help you lower your family risk, but they also increase your premiums. Okay. And benefits based on reasonable and customary charges. You'll want to look at that. Some policies consider the average fee for a service in a particular geographical area. They then use the amount to set a limit on payments to policyholders. If the standard cost of a certain procedure is $1,500 in your part of the country, then the country won't pay more than that. Okay. And we've talked about this. Different types of healthcare plans. You have private insurance, several hundred private insurance companies in the healthcare insurance business. They provide mostly group health plans to your employer, who offers the plan to the employee. Employees pay whatever employer doesn't cover as a benefit. Two big examples of this are Blue Cross and Blue Shield. Okay, those are usually the largest employers in an area for most states. Blue Cross covers hospital care. Blue Shield covers surgical and medical services. Then we also have HMOs, and that is a managed care program. It's a prepaid health plan. You have a primary care physician who manages your health care. Okay, so oftentimes with an HMO, you have a primary care physician who's assigned to you, or you pick from a list. That's your first contact. You go to him first or her first. And then let's say you need to see a specialist. You can't just go walk in and see a specialist. You have to see the primary care physician first. And then that primary care physician, if he or she thinks you need to see one, will provide a referral. If they won't provide a referral, then you can't go and see a specialist covered by the insurance. Okay. They have contracts with selected care providers, so you can only go to doctors within the plan. They have a fixed prepaid monthly premium, and the focus is on prevention and wellness, and there are basic and supplemental services. There are also things called PPO, Preferred Provider Organization. You have several providers to choose from. These cost more than an HMO. These are going to be less than maybe a private plan also, but the PPO is going to be higher than the HMO. You have more choices and fewer restrictions than an HMO. However, if you go to a non-preferred provider organization, then you may have to pay higher prices for the medical care. A point of service provider is a network of selected contracted participating providers, also called an HMO PPO hybrid or open-ended HMO. Okay. And the difference between PPOs and HMOs is becoming less clear. So in these point of service plans combine features from both. They use a network of participating physicians and medical professionals who have contracted to provide services for certain fees. As with your HMO, you choose a plan physician who manages your care and controls referrals to specialists. As long as you receive care from a plan provider, you pay little or nothing, just as you would with an HMO. However, you're allowed to seek care outside the network at a higher charge as with a PPO. Okay, we're not going to go over all of these. Okay. This is the last thing we're going to talk about because the video is getting fairly long. Health spending accounts. Okay, these are a big thing. Okay, I have one. Here, you contribute money from your paycheck every month through your employer, usually. And this money goes into a health savings account. And that money can be used to pay for medical expenses. And that money contributed as pre-tax dollars. Okay. Now, the key thing here is you have to be very good at judging what your healthcare expenses are going to be. Because in essence, let's say you have health insurance and you have deductibles, okay? And you go to the doctor, right? You go to the doctor a few times a year. You might plan for, say a kid, breaks an arm or something, and they're going to go to the emergency room. You sort of figure out how much you think you're going to pay here in terms of prescriptions, co-pays, depending upon your insurance, maybe even deductible payments, and you put that money in a health savings account. Then, as those expenses arise, you use that to pay for healthcare expenses. And then that money is tax free. You don't pay taxes on it. The only problem is if you overestimate, say you put $3,000 in this health savings account and you only spend 2,000. The difference, you sort of lose it. Okay. And that's a health savings account. A lot of times, if you don't have insurance or you self-insure yourself, you can put money in this health spending account and then use it to pay your medical expenses. Okay. And that is a little bit different than something we call a flexible spending account. These are, again, pre-tax dollars. The funds are managed by your employer, and unused funds are forfeited at the end of the year again. So that health spending account doesn't have to necessarily be through your employer. That can be, say, a person who doesn't have insurance or who's self-employed. They can put money in a health spending account and spend it. The only problem is if you don't use it, you lose it at the end of the year. Okay? I'm going to let that go. That's 22 minutes. Thank you very much. Have a great day.